Lisa Hoffman. I'm going to talk a little bit about the Affordable Care Act this evening. Um, I was tasked to choose something to talk about in my class for health welfare delivery systems. Um, so for those of you that don't know a whole lot about the Affordable Care Act, it's also known as Obamacare, but we prefer to call it the Affordable Care Act. It was written in 2010 and it was rolled out in 2013. It's 974 pages. There's not a whole lot of people that are outside the healthcare sphere that got a chance to read it, although it is online. What they really wanted to do with the Affordable Care Act is to make things more affordable for everybody, especially people that don't have any health care or insurance at all, especially for the low-income people that are like at the poverty level down to 400% of the poverty level. And we can talk about that, how much that is in a little bit. It also wanted to expand Medicaid on a state-by-state basis to cover all the adults at about 138% of the poverty level. And we wanted to also support innovative healthcare delivery methods to help save money. So the poverty level in 2018 is $12,140 for one person, $16,460 for two people, and for a family of four, it's $25,210. Just for reference on that, if one person's working 40 hours a week at a minimum wage job, their annual income is $17,160. So they're right about this. You know, if you have a couple of dependents, a couple children, you're going to be able to meet the requirements for the Affordable Care Act if you work 40 hours at a minimum wage job. So who's served by this? This is attracts low-income adults, including people that are not eligible for Medicare, which is at age 65, so anybody up to age 65. Low-income families, people with one or two children, or three or four children, or married couples with children, or single-parent families with children. There's also workers that can't afford health care in their own jobs. Say you have one of those minimum, those low-paying jobs, you might not be able to afford health care because it might be way too expensive for you to pay for. And the way that's done is through the Medicaid expansion done at the state level. There's some workers who don't have access to medical care at their places of business. Some people are unemployed, some people are underemployed. There's some companies around town, for example, who don't let employees get 40 hours a week, so they don't qualify for their health care benefits, so they're considered underemployed. And these people also qualify for the Affordable Care Act. People who own their own business, self-employed people, gig economy where people just do one job to the next and just get paid cash. If you make too much money to get the subsidized health care, you can still purchase it through the plan, but you won't be able to get any tax credits for it. So it's anybody who wants to have any kind of health care tailored to what their needs are. Any necessary changes as to who is served? I think that it serves just about everybody. It serves every American. The workplace health care might be more cost efficient for people that have jobs and health care that's available to them. One of the best things about the Affordable Care Act is that pre-existing conditions are covered. There's not any other kind of health care around that does that. You can't deny care for pregnancy. College students, when you guys fall off of your parents' plan at age 26, you don't have a job yet, you're still in college, you can apply to get the Affordable Care Act. And after you quit or lose a job, you can get the Affordable Care Act. So it sounds great. What's the catch? It's a three-pronged approach. As we show here, our little picture of a stool. If you take one of the legs of a three-pronged stool away, the stool will not stand up. So far we talked about the tax credits to help pay for the Affordable Care Act and the guaranteed coverage, but the third leg of the stool is the one that's the most hotly contended, is the individual mandate. and that's the one that we're going to talk about next. The individual mandate is required of the three-legged stool. If it is not there, then everything else will fall apart. So you're given the option of buying a plan, and if you don't want to buy a healthcare plan, you have to pay a fine to the government. They can take it out of your tax return. So the fine is meant to offset some of these other costs for the low-cost premiums and the guaranteed coverage. How much is it? Could be the maximum amount is $2,085 for a family. So it would be better for you to spend the $2,085 for healthcare as opposed to just paying for the fine, because you get nothing for the fine. It just goes straight to the government, and you're still without healthcare. So how do we have better access to people that need insurance from the Affordable Care Act? Something that they started is a healthcare navigator. These are healthcare people that it's a workforce that's come under the umbrella of the Affordable Care Act. They're employed by large institutions that help people try to find their way through obtaining healthcare and all the things that go through it. Navigators can help bridge gaps between healthcare and the underserved. There's back a long time ago when you used to apply for welfare, the welfare agencies used to share your information with the law enforcement officers. So if you had a warrant out on your arrest, the law enforcement used to contact welfare and they would give away your information as to where you were living. We don't do that with the Affordable Care Act. There's a kind of a large distrust with minorities, but with the medical profession, because the medical profession historically has not been forthright with all of their reasons for doing things. So one place we can get navigators out there are health fairs, hospitals, clinics, doctors' offices, and seminars. So who accepts the Affordable Care Act? Well, every hospital, all the doctors' offices, clinics, emergency rooms, preventive care practitioners accept the Affordable Care Act. Cancer screening providers, this is a good thing that you can get your mammograms, GYN exams, colonoscopies. These are all covered by the Affordable Care Act. And if you have to go to rehab after surgery, you can go to that, and that's covered. So who should accept it? It should be anybody that is already taking private insurance. What are my suggestions and recommendations? The hottest contention is the individual mandate. The current administration got elected to office saying that they were going to get rid of Obama and specifically get rid of the individual mandate because people didn't think that that was fair. It would be great to find a way to lower how much that individual mandate is. I think it's a good idea to explain to everybody. One of the criticisms about the Affordable Care Act is that it was passed through Congress without really very many people reading the whole thing, and that's been kind of a critical point. I think that if you have bipartisan and leadership support for the act, if you have the president behind it and the Congress people, because it's a good thing for America, I think we should revisit the act and replace what's not working. Of course, that's something that should be done with anything such a large scale. And we should take politics out of healthcare. I know that some of the Republicans want to get rid of it altogether, but I think if we can come together as Americans to try to find the better thing, either fix this or come up with something else, I think that would be the best thing to do. So, thank you for your time. Here's my